My name is Patricia, and today, along with Franco, Oscar, and Michael, we will present our solution to Safewheel. Safewheel operates in Bangladesh, and Bangladesh is a vastly overpopulated country with a population as of 161 million of today. The country stands very high in the infant mortality rate index, which places Bangladesh as 61st out of 225 countries. Bangladesh has significantly bad infrastructure, where the country lacks in proper sanitation and networking capabilities, and also the medical help is vastly insufficient. That is why we decided to help out Safewheel improve their operations. Let's move on to the background of Safewheel.
Now, Safewheel is a company who joined the Holtz Prize finalists in 2019. Its goal is to make more than 10,000 jobs in the next 10 years, and it's trying to achieve that by having these small ambulances that people can drive that can both provide jobs and also help with the poor medical infrastructure that Bangladesh has. And through the presentation that we got from the CEO of Safewheel, we can see that Safewheel faces three main problems. One of them is funding, which where they're gonna get the money, and the other one is the knowledge that a lot of people lack the basic knowledge for the medical knowledges, and the third one is the physical size of these ambulances that they are limiting in terms of what they can do. And the following are the solutions that we are trying to implement for the company.
There are three value opportunities we recognized for Safewheel to accomplish. Safewheel needs to improve the ambulance system and make it more efficient and more effective. We have also realized that there are ways how we could teach communities to respond to emergencies and medical situations better. And we also decided to propose to create a new database to create history of medical conditions of the whole families, so the whole system of diagnosing the sicknesses can be more efficient and more effective, as the medical records will make it easier for to determine the sicknesses of patients.
So we wanted Safewheel to be more connected with the rural population, and that is why we have proposed that Safewheel participate in educating younger generations at schools and communities by informing on sex education and demonstrating the importance of family planning, both which are factors of overpopulation. Also, rural Bangladesh suffers of low infrastructure that can further impact the health and well-being of the people. The low infrastructure combined with overpopulation can create a perfect cocktail of health issues in rural areas. One example on how Safewheel can help to overcome these challenges and educate communities is the problem of teenage marriage. In 2017, pregnant women that received prenatal care was at 63.9%. However, these efforts were mostly predominant in developed areas of the country. Another statistic shows that 59% of girls in Bangladesh married before their 18th birthday, and according to UNICEF, the country has the fourth highest teenage marriage in the world, which can increase the child mortality rate, as Patricia mentioned previously. Also, by appearing at communities and partnering with the Bangladesh Ministry of Education, Safewheel can connect with families about the dangers of teenage marriage to the entire community and reduce the impact that premature deaths can have in a family and consequentially in the community. A stronger relationship with the community means Safewheel can be trusted to bring changes that go beyond providing reliable transportation to hospitals and instead improve the rural community standards of education, hygiene, reduce risks of illnesses and unnecessary deaths that could have otherwise been prevented. Furthermore, the application of these services can help Safewheel obtain funding from various donors and NGOs that do not necessarily focus on health services, as Franco will touch more next.
Let's take a look at the potential sources of funding for Safewheel. First, it's important to outline that unlike a traditional startup, this venture is focused on impacting the environment, society, the community. Its priorities are not growth and profit. It's impact on humanity, basically. And we found potential sources that fund projects like this, such as UBS Optimus Foundation, which specifically is interested in the sustainable goals by UN, and MSF. To summarize the project, we suggest a 3-year timeline, $1 million in funding, and one thing that is critical for them to in effect secure funding is to have a clear outline of the objectives of this project, and they need to make sure that the value propositions and areas of improvement we are discussing, they're going to build feedback loops that allow them to measure the effectiveness and the results of where they're investing the capital. Next slide, please. So something we believe Safewheel should focus on when pitching to investors is to talk about the opportunity to partner with a Berkeley startup to use disruptive technology and solve of their problems, which is transporting people to the hospital. Through this technology, they can, in theory, in practice, bring a piece of the hospital to the community, the rural areas, and that would be these testing kits specifically for DNA tests that use new material, and they bring forward unprecedented ease of use. Basically, one way to kind of tell if technology is disruptive or not is to ask ourselves, does it bring forward 10x value, 10x cheaper, or 10x more safer? Things like that uh, mainly constitute the area of disruptive technologies. Next slide, please. Here, we would like to show how, in effect, these tests can be basically handled by anyone. We can see on step 3 that the actual machine that reads the testing device, it's very portable. And we would also like to suggest that Safewheel leverages the network of the potential funding partners it's going to reach out to, and develop nurse partners within the area. And, for example, offer the opportunity for college students who want to participate in humanitarian movements to get internship and experience in the real field by doing internships in Bangladesh and being the people behind this technology.
So conclusion, the suggestions that we have for SafeWheel are impact driven, and we would like SafeWheel to provide education for those people who needs them, and to use new cutting edge technology to expand more use cases, and also for their long term goals in order to achieve the goal of converting Bangladesh into a emerging market through laying down a proper foundation of infrastructure and technology. And thank you very much.